In today's video, I'm going to show you how to perform a very powerful exercise for treating your low back pain and sciatica. And the great thing about this is you can do it anywhere. Well, maybe not anywhere, but in most places. I'm Sam Trotke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, and today I'm going to show you how to do flexion in standing. And if you've been following my series of videos, you know that this is going to be an exercise that you do in standing. Flexion, if you remember, is when we bring our chest downward this way, so it's like when we're bending forward. That's a flexion-like position. But for trying flexion in standing, you should have already confirmed that flexion is a direction that is going to benefit you. So you should have already tried flexion in lying or flexion in sitting. And you might have found three things. If you found when you did them, they did nothing for you, they didn't make you better or worse, then try this exercise. If you found that you did them and you were better, but not all the way better, then give this exercise a try because it is a forced progression from both of those exercises. If you found you did them and it made you worse, then don't try this exercise. Flexion in standing. Stand with your feet about shoulder width apart. I like to have my hands on the front of my thighs. Down I go. As far as I can, I hold 1 to 2 seconds and then back up. Each time you come back up, make sure that you return to the fully upright position. So down I go, hands on the thighs, all the way down, hold 1 to 2 seconds, and back up. We do this in a rhythmical fashion. Down, hold 1 to 2 seconds, and back up. Each time coming fully upright. Down I go, hold 1 to 2 seconds, returning to the full upright position. Each time trying to go farther into the range. Down I go, hold 1 to 2 seconds, and then back up. If we want to get a little farther into our range, maybe we're not getting to our end range, then we're going to add a little overpressure. Down I go. I'm going to grab the backs of my legs and then pull a little farther, hold 1 to 2 seconds, and then back up. Down I go. Grab the backs of my legs or ankles, hold 1 to 2 seconds, and back up. End range is where the magic happens. That's why we're adding that progression with the ankles. Here, I'm not quite getting to my end range. So if I add a little pull on the backs of my ankles, then I get there. Everyone's end range is different. So if I have the 16-year-old gymnast, she will likely be able to go down so far, her head's going to go between her knees and then come up around the side of her back. It's like, that's her end range. If you get an older person in here, this might be their end range. And that's fine. Whatever your end range is, that's what matters. Get to that point. Down I go. Backs of my ankles grab. Hold 1 to 2 seconds. And then back up. All right, so you've got to get to your end range, wherever that is. If you're more flexible, you're going to have to go farther. If you're less flexible, you're going to go less far. Whenever you're doing these exercises, you should always check how you feel afterward. If it was painful to stand, to walk, or to get up from a sitting position, all of those should feel better after performing this exercise. If they do feel better, it's a very good indication that this is appropriate for you. If you feel worse, back off the force, maybe go to flexion lying, or you might go back to an extension-based exercise. The dosing for flexion in standing is 5 to 10 repetitions every 2 to 3 hours or as needed for pain. So if you're doing this and you find that you're pain-free for 4 hours, then do the exercise every 3 hours. If you do the exercise and you're pain-free or feeling quite a bit better for 2 hours, then I would do it every hour. But stick with the dosing that's appropriate for you and do it consistently, and over time you'll need to do it less and less because you'll feel better for longer and longer periods of time till you get to the point where you might only have to do this 1 time a day or only several times a week. I'm Sam Trotke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, showing you how to do flexion in standing. If you like what you've seen, subscribe to our YouTube channel and click on the little bell so that you'll be notified each time we upload a new video. Like the video, share the video with your friends, and leave comments below. Let us know if you've tried this exercise and how it's worked for you. If it's made you better, let us know. or if it's made you worse or hasn't been a benefit, let us know that as well, because then we can help you. We can suggest modifications to this exercise, which might make it of more benefit for you, or we can suggest another exercise from one of our other videos that might be more appropriate for you.